Hey everyone, my name is Reem and I'm a medical laboratory student. And this is laboratory stuff. So here we'll be talking about laboratory stuff. Today we are talking about blood tubes because it's very important to choose the suitable container or tube for the required test because choosing the wrong tube will affect your results. Here are some of blood tubes that we usually use in labs. Edyta tube, sodium citrate for coagulation, sodium citrate for erythrocyte sedimentation rate, plain tubes, lithium sodium heparin tubes, sodium fluoride tubes, and I think I'm missing a U in fluoride, sadly in real life too. Anyway, let's say a patient comes in and he requires a different kind of tests that require different tubes. In this case, you should follow a standard order of drawing and filling these tubes. So you start with sodium citrate for coagulation, sodium citrate for erythrocyte sedimentation rate, plain tubes, lithium sodium heparin tubes, then Edyta tubes, and lastly sodium fluoride tubes. And this order is used to prevent affecting the results and overlapping between anticoagulants. Let's start with Edyta tubes. It's the one right here with the lavender cap, and yes, I have drawn that. I'm still a beginner. Edyta stands for ethylene diamine tetraacetic acid. It's an anticoagulant that is considered as a chelating agent, which means it has the ability to bind to metals like calcium or iron. And that's how it prevents blood from coagulating and forming a clot by binding to calcium, which is factor 4 in the coagulation cascade. This kind of tubes is used in hematology tests like CBC, blood typing, identifying and counting cells, but it's not used with calcium, iron, or potassium, or enzyme tests. Why? Well, it's not used with calcium or iron because we just said it's a chelating agent, which has the ability to bind to them, affecting their results. But why it's not used with potassium? Well, it's not used with potassium because Edyta in these tubes is usually found as K2 Edyta or K3 Edyta, which means that these tubes already have potassium inside of them. So if you used this tube in your potassium test, you will only have elevated results. And it's not used with enzyme test because it will just interfere with the results. Now we have sodium citrate. There's two kinds of tubes that contain this anticoagulant. This one with the blue cap is used for coagulation tests. It's just like Edyta. It prevents blood from coagulating by binding to calcium, but unlike Edyta, its binding to calcium is reversible, and that's what makes it perfect for coagulation and platelet function tests like BT, BTT, fibrinogen level, and thrombin time. This tube contains a 3.2% of buffered sodium citrate, and a 9:1 blood to anticoagulant ratio is used. The other tube that contains sodium citrate is used for ESR, erythrocyte sedimentation rate, and it contains 3.8% of sodium citrate, and a 4:1 blood to anticoagulant ratio is used. Plain tubes does not contain any anticoagulant, so it allows blood to clot. It's used for many chemistry tests, drug levels tests, and serology and PCR. Lithium sodium heparin. This anticoagulant acts through inhibiting thrombin formation, and that is done by binding to antithrombin 3, increasing its activity. This kind of tubes is used in blood gases test. The last tube is sodium fluoride, and it has a U this time. Sodium fluoride works as a glycolysis inhibitor, and that's why it's used to measure glucose level, especially when testing is delayed, and blood alcohol and lactic acid level. Sodium fluoride can be used in association with potassium oxalate, which is an anticoagulant. Thank you all for watching, and I hope you found that useful.